it's hard to act appropriately when you have no idea what's happening, but that's kind of what I'm going to be talking about here, because where my awareness, my understanding of medical knowledge as a patient was zero at some point in the past, it is becoming possible now for me to understand some things, and that changes what is possible. It doesn't make anything new happen automatically, but that's what we're going to be talking about. I will say that of the things that you just said, I understood e-patient Dave, and I understood Thomas Kuhn. And other than the rest of it, no idea, but thank you. The moment we are in history is very similar to this stage, and I'm not saying this without evidence. This is Martin Luther nailing his 95 Theses to the door of the cathedral 900 kilometers from here about 500 years ago. The printing press was a new technology that made possible for the first time in history the spread of knowledge. And after a period, it did not immediately change the world, but after a period of time, people started to realize, as Martin Luther did, that he could read the Bible himself and make his own decisions about what was important to him. And here he is spreading the word to people who had no idea this was possible, and I will make the case to you that there are strong parallels between this moment here and what is beginning to happen, because the people on the right side there are close parallels to some of the patients that I will be telling you about. All right? And it alters what's possible. And it is not possible to understand where we might be 5 or 10 years from now if you don't have a futures mindset. Because without a futures mindset, you will be an expert in the way things are now, and that's good, but it won't let you see the future. I want to tell you a little bit about how I came to be here, because it was very improbable. Some people have said, how did you become a famous patient with a TED Talk? What was your plan? I did not have one. No. Anyway, I used to work in high-tech marketing. I love data, and I love automation. In 2007, 19 years ago, I found out that I was almost dead, and I recovered in less than a year. I'll give you a brief version of that story. In 2008, I'll be explaining what this word e-patient means. I started blogging about it, and in 2009, I found myself on the front page of the newspaper in Boston, and people started inviting me to Washington to talk about health policy, about the crazy idea that patients ought to be able to look at their medical records. Now, these days, that's not such a crazy idea, but it was back then. And people started asking me to give speeches. I'd learned how to do that when I worked in business. Anyway, then I did a TED Talk, and I started speaking overseas. In 2013, I published a little book, Let Patients Help. Now, the title is important. It doesn't mean patients know everything. It doesn't mean patients don't need doctors. And Dr. Meshko put a note on the back of it that said, how can we get this book to be read by every medical student? I appreciate it. In 2015, and I'm mentioning endorsements from the medical establishment to make the point that this isn't just me out in the wilderness saying, hey, listen to me. Maybe the people at the Mayo Clinic were crazy when they invited me to be their visiting professor that year, but they did. So what I'm inviting you to look for is what is the signal of something meaningful happening in what I'm going to be describing. I've done 800 events now in 26 countries, and last year and this year I've spoke at the National Academy of Medicine, including last week, and I'll be sharing with you some stories of other patients. So maybe they're all crazy and there's nothing to this, but let's get into it. This man died 20 years ago this month, Tom Ferguson. And he, all the way back in the 1970s as a medical student, liked the idea of self-care, encouraging us all to be able to take care of ourselves and our family at home. And when the internet came along, he coined this term e-patients, who he said are equipped, engaged. He said, e-patients are to patients as email is to mail, just the electronic version of it. In 2009, the same year that I was in the newspaper, this magazine for health for hospital managers, health leaders, decided to do a cover story about this patient of the future idea. Now, I did not have a publicist. I was not doing any publicity. This was these people saying, we think this new relationship between the doctor and the patient might be worth thinking about. And they sent photographers to talk to some of us. And honestly, if I had a publicity agent, they would have told me not to wear this shirt. But there they are. They took a picture of me sitting there in my library, looking things up on the internet, and made it a full-page photo. And that December, they do 20 people who make healthcare better. Number 1 was the famous Dr. Atul Gawande. Number 2 was Dean Kamen, who invented the Segway scooter and robotic limbs. And this was in 2009. So imagine my shock when number 3 on the list was me in that same shirt. And importantly, my doctor, my primary care physician, who was the first one to say that doctors ought to do email with their patients. My cancer story. I got a shoulder x-ray in December of 2006, so almost 20 years ago. And the next day, my doctor called me and said, Dave, there's something in your lung that shouldn't be there. To make a long story short, it turned out it was stage 4 kidney cancer. I didn't feel sick at all, but this shoulder x-ray showed a tumor in my lung. And we soon found, this is a generic diagram, but I added more dots for all the places where I had tumors, from the head down to my thigh bone, which broke and everything. And that's, when you have that many metastases, it's already bad news. And they didn't have, my oncologist said, there's no good data on people like you, so I can't give you a prognosis. But I'm the kind of guy, I went looking anyway. And the one small study that there was said my median survival was 24 weeks after diagnosis. And I will tell you, some of you I know who have had cancer diagnoses, this will focus the mind. And you go looking for help. And that's a theme that will show up throughout the other stories here. An important moment was then that physician who had been in that magazine article with me told me about a good online patient community. Now notice, back 20 years ago, most doctors would say, stay off the internet, there's garbage. My doctor showed me where to find the good things. All right, now this is the modern model. Find the good things and share it, all right? Because that's how you bring the most information to the point of need. From these patients, I got wonderful advice. For one thing, I had never known of anybody who had kidney cancer. Here I was, I knew that statistically, I was probably dying soon, and yet here I am talking to people who were diagnosed 10 years ago, and they're not dead. And I will tell you, that gives you motivation to say, how can I do that? And yet, that advice doesn't exist in the peer-reviewed scientific literature. When you look at it from the perspective of the sick person, a new world of opportunities for action becomes possible. To make a long story short, I got a rare treatment, high-dose interleukin-2, that usually doesn't work, and sometimes it kills people, but for me, it worked. There is one of my tumors, and there is the same tumor 50 weeks later. An early immunotherapy, and as some of you may know, when immunotherapy works, it's phenomenal. They never had to cut me open to get rid of those tumors. Of course, they cut me open to take out the kidney, but that's it. And my treatment, I was diagnosed in January. My treatment ended in July of that same year, and I've had nothing since, and I am all better, and I am very happy. It was a great moment 5 years later when my primary physician said, okay, Dave, it's time to start talking about losing weight again. All right, that's a wonderful thing. I was a big advocate for patients doing what they can, so it was an important moment to me when the BMJ, the British Medical Journal, came to me in 2013 and said, we think your story should be published. Now, I didn't go to them, I wouldn't have thought that, but they said this. And since I knew that physicians would be reading it, I wanted to not just give them my opinion, but I asked my oncologist, who had saved my life, what would you want other doctors to know? All right, and there's an important fact coming up here, all right? To my surprise, he said, you were really sick, and I don't know if you could have tolerated enough medicine if you hadn't been so well prepared. He was praising me for being actively involved. And what he was talking about, this medication, the side effects kill 4% of patients. Now, you can be a passive patient and say, I hope that won't happen to me. But I said, okay, so how do I prepare? What do I have to know to beat the odds? And he said, that's a good question. Nobody has ever asked us that before. So that was the first sign of me being an empowered patient in 2007 when I had never heard the term. I then turned to my patient community that my primary physician had sent me to, and I got 17 stories from people who had been through the medication. And every time one of those side effects hit, I knew what was happening, and I was better able to get through it. Some people think I'm crazy, so I tell them, go ahead, ask Dr. David McDermott, there's his name in the BMJ, and argue with him. I'm not qualified. So here's the important, this is the Thomas Kuhn paradigm-busting question, because in Kuhn's terms, an outcome that doesn't fit the paradigm is an anomaly, and it means the paradigm has a big problem. So how can it be that the most useful information, how to survive side effects, could possibly exist somewhere outside the medical literature? All right, this is a real question, and the answer is knowledge is power, and access to it has changed forever. It no longer comes only through the medical journals. And the model of this network diagram that works for doctors is you think of these as capillaries. Right? Doctors like medical analogies. That's a little capillary without central control where knowledge can flow around. And then they go, oh, I understand. Yes, that works in the body. We are right now in the fourth big wave in the history of patient empowerment. Right? You think back to the Martin Luther photo. Before the printing press, there was no way for the people in the villages to have access to the knowledge that was in print, that was in what was handwritten. But now, first, with the web, we got access to information with Googling or Yahoo before that, or Alta Vista, other search engines. Pretty soon after that, we had PubMed for access to the literature. A huge breakthrough that Dr. Meshko has made quite a career talking about has been when personal health devices gave us access to measurements. My Oura Ring, my Apple Watch. This morning I opened up my Heart Analyzer app to see how my heart rate had gone up as I climbed the stairs here. In medical terms, there's this idea of SOAP notes. The O is objective data, and patients have their hands on more of it now than they ever have before. I'm having a blood pressure problem for the last few months, and I have much more data than any of my doctors wants to see. right? In fact, 2 doctors told me to stop gathering so much data. I said, no, I will not do that. But the more data we have, the more it raises the essential question, what does it all mean? And that's where the huge breakthrough is, that we get clinical reasoning because of generative AI. We can say, here's a bunch of information. What is this? What's happening? What's going on? Okay, and patients are users of AI in a variety of ways. Now, this causes attention. All right, and I'm now going to get into some specific stories of where doctors and patients have different views of what's going on. On September 11th, in 2023, I was at a health data conference when a famous IT doctor said, it's too early for us to give generative AI to patients and expect that the results will be good. On that same day, this story appeared. This boy had all kinds of pain that nobody could figure out. 17 doctors over 3 years, nobody could find the problem. His mother, I have met his mother, Courtney Hoffman, sat down at 10 p.m. one night and poured all the radiology reports and everything she had into ChatGPT, and at 2 a.m. it found the answer, tethered cord syndrome. She took it to a doctor. They confirmed the diagnosis. 6 weeks later, he had the surgery, and it solved the problem. Now notice, when patients use AI, it's not a rejection of doctors. She'd been to 17 doctors, right? But she wanted more help. Here's another example. My friend Hugo Campos, very famous in the world of patient AI. He is the care provider for his 93-year-old father. And his father had a horrible rash that would not stop, would not respond to anything. His local hospital system said, you can see a dermatologist 4 months from now. So while they're waiting 4 months, he got out his LLMs and gave it all kinds of information. And you can look this up. If you just search patients use AI, you'll find that the blog where all of this is. He did this detailed prompt: examine the provided photos, consider the differential diagnosis, keep an open mind, and give me the results in a 4-column table. Now, most people don't talk to their AI that way, but here's an example of what he got. And he noticed that of the 5 proposed diagnoses, the recommended actions were similar. So while they waited to see the doctor, he started doing it. Dietary change, fewer hot showers, and in 10 days, the father's rash started improving, and 2 weeks afterwards, this was the result. This is a wonderful thing. By the time they got to the doctor, it was a very different story, and he confirmed what the diagnosis was. There's a really important thing, and I'll be coming back to this in a couple of minutes. He has said something that I think is, I called Hugo's Law. I'm a marketing guy. I come up with slogans, okay? He says, I don't use LLMs to give me answers. I use them to help me think. And this is what we need to teach people how to do, not just ask it for an answer. All right, here's another example. Sue Sheridan is famous in the United States. She had 2 medical disasters in her family. One was her son, who ended up with permanent brain damage, and another was her husband, who died because of a loss of medical information. Well, she works in patient safety now in the American health system. And earlier, about this time last year, she had a problem happen. She had pain after a dental appointment. The whole story is here. Anyway, she went to one emergency room, and they said, well, it's not Bell's palsy, it's not this and this and this and this, so just go home and wait. They actually said benign neglect, to try benign neglect. Well, she went home, and she and her husband, who's a doctor, went to ChatGPT, and it said, it is Bell's palsy, go to another emergency room. And they did, and they got her on the steroids. And it's a good thing, because they were almost out of time. So there's another example. And here is, last week I was at the National Academy, as I mentioned, with Hugo and Sue, and she had this comment: everybody's saying doctors adopt AI at the speed of trust. She said, we, the patients, adopt AI at the speed of desperation when we're out of other options. And I think a good case can be made. You don't have to be desperate. I would always rather talk to my doctor, but he would get really tired of answering the phone every time I have a question. Right? So what I do is I do everything I can, but then I have to bundle it all up into something for him. We'll get to that. This is Bethany Crystal, a software startup founder in New York City. Last May, she noticed she had some little red spots on her leg, and to make a long story short, this was on a Friday night. The doctor's office was closed. She looked at the patient portal and got her lab results, and she started talking to ChatGPT, and this is the blog post she wrote, because ChatGPT said, go to emergency now, do not wait. You're almost out of platelets. This could cause all kinds of serious problems. So she blogged all of this stuff, and it's what to say when you arrive. I have severely low platelets and things like this. Fabulous story. And when she couldn't get a response from the doctor's office, she went back and it started asking her questions. Are the red spots getting worse, and so on. And when she blogged it, this was great. Here, from her blog post about it, the nurses and doctors said, how did you know how to come in? She said, ChatGPT convinced me, and she waited to be scolded. But instead, one said, good for you. That's what we want AI to do, help people catch things early. A new world is coming alive. It really is happening. My blood pressure problem I've been having for several months, my ability to talk to the doctors has been radically better because of the work I did at home. But there is a danger, right? If people stop thinking, remember Hugo said, you got to use it to help you think. If people stop thinking, right? There's this new article just came out. This is from a very good technical website, but it's about a preprint article about cognitive surrender. Cognitive surrender is what we do if we stop, if we start using satellite navigation in the car, and so we forget how to find our way around on our own. We just give up the thinking. If you do that with AI, well, what these researchers did a good job of documenting is that 80% of people, if they haven't been trained on how to use AI properly, will miss stupid, wrong answers from an AI. They set up an experiment, things that could be easily fact-checked. So this is a real risk, and in medicine, the consequences are a lot worse than if you're just looking for a restaurant recommendation, right? So the future is so close I can taste it. In the same way that Bethany had her outcome improved because ChatGPT asked her questions, in the same way that Courtney's son, right, was cured because of how ChatGPT found something, in the same way that Sue got advice that kept her. If it hadn't been fixed, her face would have been permanently paralyzed, but she's all better now. That's a wonderful thing, and Hugo's father. But the question is, see, all these AIs are separate from the health system. And what I hunger for is to have them integrated. This is a paper that I'm a co-author on that just came out this month, where we proposed a new relationship where the doctor has a good, medically competent LLM that sits between me and the doctor. So at the first symptom, it's got to be reliable for the doctor, but it's also got to be friendly so ordinary people will use it. It can't be boring and clunky. If people enjoy using ChatGPT more, they will. So this thing needs to be friendly. At the first symptom, I start talking to it instead of ChatGPT, and it coaches me like these stories. And then if it gets to where it decides it's time to call ambulance 2040, the data's already in the system, ready to load up. So when the ambulance is coming, they don't have to say, all right, tell me what happened, right? This is a beautiful new redesigned technological flow. But there's a big risk, because I don't know about here, but in the US, hospitals tend to want to design something for patients and then give it to them and say, use this. And frequently patients will go, eh. So the question is, will you include us in the work or do it without us? And this is why, notice the date on this article. 3.5 years ago, Dr. Meshko and I published this paper on patient design. Notice this was 3 months before ChatGPT came out, but look at what the abstract said. A paradigm shift is underway in the patient-clinician relationship. We had no idea how big that was going to be, but this is futures thinking. When you're thinking, how could things evolve? Let's see, we're already witnessing early signs, empowered people living their lives, managing their health according to their own priorities. I'm proud of having been involved in this paper, and it makes it, when something that is as world-changing as artificial intelligence comes along and it doesn't knock you over, that's valuable thinking. This new technology has created a new kind of citizen. We can have our own thoughts about what's important to us. We can say, I want to understand more about that. Some people will say, that's enough. I don't want to know anymore. That's fine. The whole point is that we need to design for this kind of citizen for the world that we know is arriving. It's a world where the National Academy of Medicine would have Sue Sheridan and Hugo Campos there. This was a clinician forum, a multi-month project on the future of healthcare in the age of AI. They are listening, and it's just really inspiring. And I will tell you, I'm going to go back to the very beginning. I am very glad that those good doctors saved my life 20 years ago. So thank you to all of you who are actively involved in medicine and have helped guide it to where we are today. I got to see my daughter get married. I got to become a grandfather. I got to come to Budapest. You know, just having a wonderful life. So thank you so much.